Hi guys, it's Dr. Tauquir Ahmad here from our clinic in Glasgow, and what I'm doing today is I've got a post-traumatic scar in a patient who I'm dealing with, and when I examined the scar, it was definitely a traumatic scar. It had left a mark in there. It was indented and the surface was irregular. So on examination, I decided that, it was probably tethered to the ground. So what I decided to do was a three-pronged strategy. One was subcision of the adhesions under the scar. Secondly, what we were going to do is use the Plexr machine around the edges, because the scar it's narrow in the middle and inverted at the top. So the Plexr round the edges, what it does is it brings it outside in. The subcision at the bottom helps lift it up. It breaks the adhesions. And in addition, we're going to use our VirtueRF machine. And it's the world's most advanced radio frequency microneedling machine, because all machines before was just delivering energy in continuous mode. This is doing it in pulse mode, so it can be used on dark skin types, and it will stop post-inflammatory hyperpigmentation. And what we're going to do is we're going to go in at 3 mm, 2.5 and 2 mm to break the adhesions inside and also to stimulate collagenesis. And then at a level of 1 mm, we are going to infuse in depigmenting mesotherapy. Because it's a Fitzpatrick skin type 6, a darker skin type, it is to prevent any hyperpigmentation after the treatment. So the first part has been to do the subcision, and there's been quite a tough case of subcision to do here, and we're actually feeling a lot of the lesions here. So we've managed to break down, and it will take a few sessions, but with this combination approach of subcision, Plexr and VirtueRF, we should be able to give the patient between 50 and 70% outcome, which is the difference from being conscious to confident. Thank you. So here's the first part. We've got a bit of subcision, just breaking the underlying adhesions in here, tethering away at the tissues. We can hear the adhesions actually breaking. You can actually feel them breaking down. So we'll be doing this. This is the first part. The second part of the treatment involves me doing the Plexr, and I'm going around the margins of the scar here, just to bring it down. So I've done the subcision in the middle. Now the sides are raised, and what I'm going to do is bring this down. So we've now got the VirtueRF machine here, and as I was saying, it is the most advanced and sophisticated machine because of the way it delivers energy. So what we're going to do is, because of the skin type that we have, we're going to switch it to 2 megahertz. We're going to have not the energy in a single pulse, but we're going to split it. But because we want to do scar treatment, we're not going to split it too much. At the very end, when we're going to use it to treat any pigmentary changes, we can increase the pulses. And it will go in, and it will also have LED light therapy going in at the same time as the treatment is happening. And we will then be able to change the settings as we have accordingly, the depth, the amount of energy, and the amount of time we want to deliver the energy. And I'm hoping within 3 or 4 sessions, this chap's going to have an amazing outcome. Thank you.